Hey, everybody, it's a huge privilege that we have today that my guest is Dr. Aseem Malhotra, who is an NHS-trained consultant cardiologist. That's the National Health Service in England. He's an honorary council member to the Metabolic Psychiatry Clinic of Stanford University School of Medicine in California. He is a cardiology MSc examiner at the University of Hertfordshire in the UK. He is one of the best known and eminent cardiologists in Great Britain, and he was one of the first to take 2 doses of the vaccine, of the COVID-19 vaccine, and promote it on Good Morning Britain. Last month, he published an article, he's one of the authors of an article, published 2-part research paper, published in the eminent Journal of Insulin Resistance, and it's called Curing the Pandemic of Misinformation on COVID-19 mRNA Vaccines Through Real Evidence-Based Medicine. I want to say that Dr. Malhotra is has devoted his life and has become one of the preeminent experts on evidence-based medicine and outspoken experts. And what he concludes in this paper is that the real-world data reveal that in non-elderly populations, the number needed to vaccinate to prevent a single death from COVID-19 runs into the thousands, and that a reanalysis of randomized controlled trial data from the initial vaccine clinical trial suggests a greater risk of suffering serious adverse events from the vaccines than to be hospitalized with COVID-19. And your willingness, your courageous willingness to be outspoken on that subject and publish that. I mean, you must have known that was going to be like a career killer for you when and I know you've done amazing stuff in the past, going up against the sugar industry and against statins. I think you got very, very famous for talking about the need for evidence-based medicine on statins. So you're used to controversy. But what led you to take this kind of, stepping off a cliff, the controversy that you've just stepped into?
Yeah, no, thank you, Robert. It's a great question. And I think first and foremost, it's trying to, first of all, for me, my primary duty is to my patients and scientific integrity. And I've always acted from that place when it comes to any kind of advocacy work, when it comes to medicine over the last throughout my whole career, and certainly over the last decade. And once I had a realization of what was really going on with the vaccine, the COVID vaccines in particular, and the strength of the evidence, and the fact that it was overwhelming in terms of being able to give a very good estimate of the serious adverse events, and realizing this was unprecedented, I then went down a track to really try and critically appraise the data so that we could give information through the paper in the best possible way we can right now. And I'm sure things will evolve and be maybe more definitive with time. But to start having a conversation about informed consent, because, you mentioned evidence-based medicine, and it isn't really rocket science. For me, evidence-based medicine follows a very simple, elegant, analytical framework for teaching and practicing medicine. And that is, a doctor uses, or a healthcare practitioner uses, their individual clinical expertise and experience, clinical intuition as well, the best available evidence. And then last but not least, Robert, which is the most important, is taking into consideration patient preferences and values on an individual level. And of course, you can't take that into consideration unless you've given patients information in a way that they can understand. Now, the problem, even before the COVID vaccines, briefly, is that the best available evidence over the last 2 decades, unfortunately, as you know very well, Robert, has been corrupted and by commercial influence. So what happens ultimately in the consultation room, in looking at the big picture, is that doctors are making clinical decisions on biased information. And it doesn't, again, take a rocket scientist to work out that if that's happening, you're not going to get the best outcomes for your patients, or at worst, do them harm. And this is actually the root cause, in my view, of our healthcare crisis. You look in the UK and the US, certainly in the UK, in the last 10 years, life expectancy has stalled. We've got more and more people living with chronic disease. So people are getting sicker. And that, for me, tells us something. What is the net effect of the medical industrial complex, if you like, on society? And because we have not tackled the root cause of the problem, which is essentially these very big, powerful corporations, big pharma, who are there as money-making machines and therefore give us unreliable or corrupted information, unless we tackle that at the root, this problem will continue. So I already had a background understanding that before the vaccine came into the equation, Robert. But people may ask me, so hold on, Aseem, you've been one of the biggest critics, outspoken critics of the pharmaceutical industry for the last 10 years. Certainly as a clinical doctor in the world, I've been one of the most outspoken. I've taken my case to the European Parliament in 2018. So how did you get deceived, if you like, with hindsight on the vaccine? How did you get into a position where you were tackling vaccine hesitancy in Good Morning Britain? And the reason for that, Robert, is, up until this situation arose, I couldn't even conceive of the possibility of a vaccine doing any kind of harm whatsoever. And I know, of course, there are many people, and there is a big movement, certainly, around concerns about other traditional vaccines. But even if there is some element of harm, and no vaccine or drug is completely safe, if you compare traditional vaccines with all the other drugs we prescribe, Robert, whether it's blood pressure pills or statin drugs or diabetes drugs, they are still far safer than those drugs. So I couldn't conceive of it being a problem. I was a little bit unsure about the efficacy. And then obviously in January 2021, we didn't have the information, certainly in terms of the high quality evidence we have now, we didn't have that. And therefore, when I went on Good Morning Britain to tackle vaccine hesitancy, I didn't go and point fingers at people and saying unvaccinated are, they are crazy or whatever else. I actually said, listen, there are rational reasons for people not taking the vaccine, and there are some irrational reasons. And some of the irrational reasons, of course, I felt were things like people saying it was part of a depopulation agenda, there were microchips in the vaccine, all that kind of stuff. But the rational concerns I addressed, and I said, listen, look at the history of what pharma have done over the last 10 to 20 years, the fraud they've committed. These are industries that are there to make money. And we know that, for example, prescribed medications are the third most common cause of death after heart disease and cancer. So I said, I understand the rational concerns, but even despite that, I say vaccines are still, as far as I'm concerned, one of the safest pharmacological interventions in the history of medicine. And then over time, I think the thing for me that was probably the trigger, or certainly in hindsight, the trigger, was my father, who was a very eminent doctor in the UK, considered, one of the most prolific advocates for the National Health Service. He was a retired general practitioner. He was a prolific writer. He was very political. He was, the Labour Party National Doctor of the Year, which is equivalent of what you say the Democrats in the US. He was named that for all his work as being an NHS advocate. He suffered an unexplained sudden cardiac death in July, and he was a very fit guy. I knew his cardiac history inside out. Everybody was shocked in the community about it because he was considered amongst his peers, of his age, one of the fittest guys. I organized a post-mortem, and his post-mortem was shocking. He had 2 critical stenosis in his arteries, 2 severe blockages. Didn't make any sense to me. I couldn't explain it. I thought the only thing that I thought could be a possibility is that was he, as a widow, we lost my mum just 2 years earlier, was the effect of that, causing to have rapidly progressive heart disease. But he was still very active. He was still very mentally active. He was social. He was going on TV as part, as a vice president of the BMA. So he didn't fit also with somebody that being, a social recluse or had become severely lonely. And of course, I was there and we were very, very close. So it didn't really add up. And then several bits of data a few months later emerged, Robert, which basically suggested, and people can read my paper, I won't bore you with all the details, but they can read the paper because the references are there, suggested that the mRNA vaccines in particular, there was a mechanism that they could potentially accelerate heart disease. Now, if that is true, and I believe it to be true now, then of course that's going to cause a surge in heart attacks. It's going to cause an increase in out-of-hospital cardiac arrests. Certainly in the UK, in 2021, we have 14,000 extra out-of-hospital cardiac arrests, which are unexplained. Israel did some very interesting, useful analyses published in Nature reports. And this is very disturbing. They found in 16 to 39-year-olds, there was a 25% increase in cardiac arrests and heart attacks associated with the COVID mRNA vaccines, but not associated with COVID. So for me, there were so many data points that were painting a picture. And I think then finally, Robert, the icing on the cake for me was the reanalysis of Pfizer's original trial, looking at new information that emerged from the FDA's website and Health Canada's website, carried out by some of the most eminent, respected scientists in the world, Robert Kaplan from Stanford, Peter Doshi, associate editor of the BMJ, Joseph Freeman, who's the lead author who I know and have spoken to. And what they found from the original trial, which is the gold standard of evidence, where you correct for confounding factors, one was more likely to suffer a serious adverse event from the vaccine than they were to be hospitalized with COVID. And that was during the original Wuhan strain. And that figure roughly was about 1 in 800. I've looked at data around the world, equivalent of your VAERS in the US and yellow card system here. Norway has probably been the most robust in terms of being quite transparent in documenting with doctors what they felt was a serious adverse event from the vaccine. So these are things that are life-changing, result in hospitalization, heart attacks, strokes, etc. And they came out with a figure after 2 doses of the Pfizer vaccine, it was 1 in 926, which is very similar to the data from the RCT. So for me, Robert, it's a no-brainer. The evidence of harms are clear. We have a good estimate of what the harms are, at least to that figure of 1 in 800. We have the WHO endorsing a list before even the vaccine was rolled out of potential serious adverse events that could happen from this vaccine based upon 4 bits of information: 1, animal studies; 2, the technology that was being used; 3, other harms from other vaccines; and 4, COVID itself, severe COVID itself. And they actually made a list, which I've actually put in my paper, which people can look at. And if you look at that list, it's exactly what we are seeing in the community and clinical practice. The problem is many doctors aren't going to diagnose it because many of them, like me, 18 months ago, can still not conceive that a vaccine can do this level of harm. And that's really what we need to overcome. And what I try to do with that paper is to open people's minds up by saying, listen, I had the vaccine. I believed it was safe. I got it wrong. The information I had to go on at the time was limited. The information now is unequivocal, and we need to do something about it. And we need to suspend it for everybody until this data is properly investigated.
One of the problems, I think, is that it's not just a kind of a circumstantial ignorance among doctors, but it's an orchestrated ignorance where doctors who do talk about it are punished and they're ostracized. And in our country, they're delicensed. We just passed a law, and Governor Newsom signed it into law here in California, that makes it illegal, that outlaws second opinions, essentially. It outlaws doctors from saying bad things about vaccines or about any differing publicly or to their patients about departing from the CDC orthodoxies. And the problem with that is that you have, first of all, it obliterates the relationship that you talk about, the traditional relationship that has existed since Hippocrates, where a doctor's responsibility is to treat their patient. And now the doctor's responsibility, in California at least, is to act as an agent for government policies and to treat their patient for the greater good, and not particularly that patient. That's a very, very slippery slope, as we've seen throughout, totalitarian regimes. When doctors start treating patients for the greater good, it ends up in a bad place. But the problem is that, and I think one of the reasons that people don't understand vaccine injury is doctors are taught it doesn't exist. Oh, if you see, for example, there were all these injuries in chronic disease that we saw amplify in this country beginning in 1989. Food allergies suddenly appeared. Peanut allergies, never been like that. They are now epidemic. I had 11 brothers and sisters. I have 77 first cousins. Nobody had a food allergy. And why do 5 of my 7 kids have allergies? Asthma exploded. Rheumatoid arthritis, juvenile diabetes, all these autoimmune disease, neurodevelopmental disease, ADD, ADHD, speech delay, language delay, tics, narcolepsy. But a doctor who sees these, a pediatrician who's giving these vaccines to children, and then 4 years later, the kid comes back with food allergies or autism, is not making those connections. And, we have to, and they're discouraged from making them. They're discouraged from reporting them. And that is the problem, is that doctors need to be able to practice medicine and practice healing, and to say things that differ from the, from the consensual orthodoxies.
Yeah, Robert, you're absolutely right. I think you raised a point that's really important around, the only way to progress is actually through open, honest, transparent debate. And certainly with the COVID vaccines, this is a symptom of a much bigger problem. You talk about the government sort of dictating what doctors can do. I would say that going even further to the root of this problem isn't so much about government, it's about failed government. And the reason they're failing is because they've been captured by corporate entities who are money-making machines legally. That's what they're, that more than anyone, Robert, that they are there legally designed to produce profit for shareholders, not to give you the best treatment. And in the process, in the way that they function, they are not human. They are anti-human. And to quote even, one of the most eminent forensic psychologists in his field on psychopathy, Dr. Robert Hare, he actually says that the way that the institution that is the big corporation functions is essentially very similar to psychopathic behavior: deliberate deception in order to make money, callous disregard for the safety of other people. This is what a psychopath is. And we have lots of evidence for that. Now, the problem we've got, and this is and I'd love to debate this with you, we have increasing unchecked power of these corporations over time. So conceptually, if you see, for example, I would say maybe, with the best intentions, this is the end result of unchecked power, which was started because of neoliberal economic policies by Margaret Thatcher in this country and Ronald Reagan. And they may well have been best intentioned, but the machine is now out of control and it's causing tremendous harm. The overall effect of the drug industry on society in the last few decades has been a negative one. If you look at the Marcia Angel, the former editor of the New England Journal of Medicine, the highest impact medical journal in the world, her own analysis reveals that of the 667 drugs approved by the FDA in the first decade of this century, 2000, 2010, for example, only 11% were truly innovative, Robert. 75% were copies of old ones. Huge waste. So we've got this corporate machine that is doing things that are anti-human, are suppressing free speech, and in my view and I've said this before, and I say this for the food industry as well, they are enemies of democracy. So what we're really fighting for here is real democracy. Nobody in their right mind, I speak to patients or members of the public and I say, do you know that the regulator who is approving drugs get most of their funding from the drug industry? How do you feel about that? Nobody finds that acceptable. So what we've got is unjust, undemocratic, unethical laws that is perpetuating this problem. And therefore, through dissemination of information, through citizen power, we need to change those laws. And I wanted to ask you a question, Robert, as well, if you don't mind. I've followed, through documentaries and reading, I followed both, President John F. Kennedy and your father's work. And I found the kind of work he did extremely admirable. And one of the things he said was that, talking about poverty in the United States or social inequalities, he says, we need laws to remedy these injustices. I wonder, I was going to ask you, what would your father think of this situation? What would he be doing about it? But then I thought I'd answer it myself, maybe. I don't even think the situation would have arisen, because I think if your father had become president and hadn't been tragically killed, I don't think these corporations would have had the power they have now. I'm just curious to if you don't mind me asking you, Robert, on that, what you think.
Well, I never speak for my father, my uncle. I've got a big family and nobody wants to hear from my family what other people think. And a lot of them, my family differs from me in my opinions about this particular issue. So, but, I would say I love what you said about, the corporate subversion of these democratic institutions. And, corporations are immoral organisms. We created them as such, and that's how they function. If in the United States, it's actually illegal for a company to do something that's truly philanthropic. And here's an example, when you see Walmart sending cases of water down to the victims of Hurricane Ian, they're not doing that to be good people. They're doing that because they believe the public act will accrue in some financial way to shareholder value over the long run. And if they are doing it just to be a philanthropy any of their shareholders can sue them for wasting corporate assets, and they will win that lawsuit. So the company legally is not allowed to do anything good. Is that a bad thing? That's actually genuinely altruistic. They always have to have an ulterior motive. We create them that way, and it's not a bad thing because we create these companies so that in order to accumulate or in order to put together large amounts of wealth and then spend the money in things that will generate and amplify our economy.
Yeah.
But we have to understand that is an immoral organism, and we need laws to make sure we need laws in place to make sure that they behave. We have to make sure that they cannot influence. Listen, if one of these companies gives money to a politician, they're not doing that to be a good guy. They're not doing it for patriotic reasons. They're doing it because they think that they can corrupt that person to skew, some federal benefit their way. So, we need to create these mechanisms. And I would say the first thing is to prohibit them, go back to the old rules that prohibited corporations from funding our politicians, because that, and as you point out, during the Reagan years, through best intentions, people believe that these regulatory structures needed to be public-private partnerships instead of, a regulatory institution that is protecting the public interest as a whole. That they needed, that the regulatory agencies should be looked at as kind of the protector of that industry. And what we have is this regulatory capture where the regulated industry becomes really a sock puppet for the industry it's supposed to, and an enabler for the industry it's supposed to regulate. And as you point out, FDA, this is astonishing, it's almost 50% of its budget and 75% of its drug regulation budget from the pharmaceutical industry. If you work at CDC, you do not get promoted. You do not get a salary increase. You do not get good reviews for finding problems with those products. Your path to, to success in life is to increase vaccine uptake, not to find problems that are going to make people doubt vaccines. So you have this whole institution. And I don't know who Dr. Hare is, who you just quoted, but I got to get a hold of that quote because I think it's such a really, profound and eloquent description of what the end point is for this system of regulatory capture, where the institution becomes utterly sinister and corrupt. And that's what we have with CDC. Unfortunately, you're one of the few doctors that recognizes that. In our country, people, doctors believe if CDC says it's true, it's got to be true. And they don't know that the CDC is systematically deceiving everybody.
Yeah,
it's a snake pit of aseptic corruption. And,
absolutely. Yeah. No, Robert, I would add, my vision, or the way I see things going, and of course it's important for us to speak out, but it's ultimately self-destructive. It's a false economy, because if you are making money, or the economy is dependent on something that is false or essentially lies, and of course that's gonna ultimately, that bubble's gonna burst. In this situation, it's the health of the population, and this is the two big drivers of poor health now. Overall negative impact on society when it comes to health are big food and big pharma, and as the health gets worse, it's very interesting. If you look historically, when people's health get worse, they actually have less trust in their government. We don't want that situation to arise, but inevitably that's what's going to happen, because the truth is still the truth. People can see what's going on. People look around them. Mental health is getting worse. Physical health is getting worse. And the pharmaceutical industry are part of the problem. They're not part of the solution right now. So we need to make sure, as you say, the function of government is one of the functions of government is to protect their citizens from external aggressors, but also to protect their citizens from disease and to serve their communities. And the government are not doing that. They're not doing that at all. And I think people need to wake up. That I think one of the challenges we have, and of course we have social media that is growing, and this movement is growing definitely from a social perspective. A lot of people are becoming more and more aware. But still, the most impactful, what shapes public opinion, more than anything is still the mainstream media. But the problem is, Robert, as well, is that certainly in America and to some degree here, the mainstream media also is captured by these big corporations. And that's a big problem. But, everybody is affected by this. If society fails, we all fail as individuals. I think even convincing the likes of people like Jeff Bezos or Bill Gates or Elon Musk, who have profited from the system, that actually them speaking out and saying the system needs to change to protect their kids, the future generations, protect society, I think they need to get on board as well. We need to be able to have dialogue with those people that are even benefiting individually, financially from this corrupt system, and actually making them realize that they are part of what is something ultimately going to be detrimental to the world and will come back and hit them hard. And we need to have that conversation with those people as well.
Well, you know what? I've tried to have that conversation, by the way, with Gates for many, many years. I've written them letters and asked them to look at some of the peer-reviewed studies that have been done, particularly by the Danish government. Did a study of the DPT vaccine, the most popular vaccine in the world, 161 million African children given a year, and they did a very extensive study led by these deities in vaccine, pro-vaccine researchers, Peter A. Abey, Sigrid Morgensen, and multi-million-dollar studies of DPT vaccine, where they looked at 30 years of data, and what they found was the DTP vaccine was protecting children from diphtheria, tetanus, and pertussis, but that girls who got that vaccine were 10 times more likely to die over the next 6 months than children who did not, and they were dying of things nobody ever connected to the vaccines. They were dying of bilharzia, malaria, anemia, dysentery, and mainly pulmonary and respiratory illnesses and pneumonias. And for 30 years, as these girls died at 10 times the rate, of vaccinated of unvaccinated girls, nobody noticed because nobody connected those. And what the vaccine had done, the research concluded, is that they were protecting the girl against these very narrow targeted diseases, clades of these particular diseases. They had ruined their immune systems, and the immune systems were unable to defend themselves against common infections. And that, the children who were getting the vaccine were much less healthy, less likely to survive than children not, and it was invisible. And that's why you need, at the beginning, that studies that actually look at all health outcomes in a vaccinated versus unvaccinated population, and you need to have a long enough, at least 5 years, in order to really understand, because a vaccine will fool you. It will tell you, yeah, this kid is not dying of measles, but if he's dying of cancer, and we know that children who get wild measles when they're young are less likely to get non-Hodgkin's lymphoma, Hodgkin's lymphoma, atopic diseases, cardiac diseases when they get older. So there's something that happens, and we do not understand enough about the immune system to be able to predict when we give a child something that is designed to permanently alter their immune system, that has been developed through 4 billion years of evolution. What are the unanticipated outcomes? And you need to do real vaccinated versus unvaccinated studies. So for many years, what I pointed out is in our country, vaccines are exempt from pre-licensing safety testing. And the reason for that is because it's a legacy of CDC's beginnings as the Public Health Service, which was a quasi-military agency, and the vaccine program was conceived as a national security defense against biological attacks in our country. So they wanted to make sure that if the Russians attacked us with anthrax or some other botulism or some other biological agent, we could quickly formulate a vaccine and then, distribute it to 200 million Americans with no regulatory impediments. And they said, if we call it a medicine, we're going to have to do placebo-controlled testing. So then we don't have time. So we'll call it a biologic, and we will say that biologics, adopt a policy that say biologics don't have to do pre-licensing testing. So for many years, I've been saying Not one of the 72 doses of 16 vaccines now mandated for American children has ever been placebo tested in pre-licensing safety studies. Tony Fauci and everybody were saying he's not telling the truth. That's misinformation. So I sued them with Aaron Siri. And I said, show us one study from any vaccine. After a year of litigation and stonewalling us on the courthouse steps, HHS came out and said, yeah, we've never tested one of our vaccines, not one of them, in pre-licensing safety testing, placebo-controlled trials. And that's really, that's a huge problem. One of the things you talk about, which really puts our finger on the problem, is this typhoon of misinformation and about medicine, and how there's no clarity in the data. And that, I think, is one of the defining features of COVID, that they were vague and hazy about infection fatality rates, and again about everything from the beginning. There was no way of it was like pushing on jello. You had no way of saying, okay, let's compare this to the flu. Let's stratify the data and see, are young kids getting it? Are they, what is the susceptibility by age? Who does it make sense to give this vaccine to? It was all direct. And then all of the really bad stuff they did on early treatments, like hydroxychloroquine and ivermectin and all these others, where they just, they created these phony studies. And I'm wondering, where did you get data that made you certain enough to make this profound and really consequential statement that the vaccines are causing, that vaccines are causing more adverse events than COVID? Because it's very hard to get data. I know you looked at ambulance calls for cardiac arrest.
Yeah, Rob, it's a great question. I think I put a few things together. Certainly, in terms of what you mentioned already, the infection fatality rate, there are two scientists, one in particular that I describe when I give my talks as being a Stephen Hawking of medicine, and his name's John Ioannidis, Professor John Ioannidis from Stanford. Very, very bright guy, most cited medical researcher in the world. And he actually did the first study with Jay Bhattacharya in Santa Clara County to try and give us, and that was very useful and helpful, an infection fatality rate at the very beginning. And I think that put things in perspective in terms of understanding, first and foremost, that in the older population, certainly it appeared that the Wuhan strain was significantly more concerning and devastating than the flu vaccine. Of course, a lot of people died in care homes. But the gradient of risk from as you mentioned already, from children up to the elderly was 1,000-fold difference. So I remember him actually speaking on CNN quite early on, saying, for the elderly, this can be devastating. For people in middle age, it's equivalent to the flu. And interestingly, for kids, it's less lethal than the flu. Now, that was never part of the mainstream narrative on a consistent basis. And therefore, a lot of people went around with exaggerated fear. That was in terms of the infection fatality rate of COVID. And I think it's important to understand that, because a lot of people's behavior and reactions, and even how they responded in terms of the vaccine, was based upon that original fear of COVID. I have a friend who, I'll answer your question about the data on the vaccine in a second, Robert, but I have a friend who's a broadcast journalist for Chinese television. And recently I saw these images a few months ago coming out of China with the Omicron variant. And there were, Chinese policemen, or whatever you want to call it, wearing hazmat suits, being very aggressive with the population. And I sent her a message and I said, what's going on here? Why is this happening in China? And she obviously understands what's happening in terms of the authorities and what the mindset is. And she said to me, Aseem, she wrote back, you've got to understand, most Chinese people still think that COVID is like Ebola. Touch it and you die. And he said the Chinese government, many people also are behaving in that way. So you've got all this misinformation that goes to the very highest levels, and that then drives policy. When it comes to the vaccine, COVID vaccine, Robert, I think for me, it was incremental. So there were bits of data that started to emerge. And then when you put it all together, first of all, you understand the mechanism of harm. And there was a paper published in Cell that explains how the spike protein goes around different organ systems in the body and can stay there for 4 months, causing either direct toxicity or autoimmune reaction. So you've got a mechanism of harm. Then you look at the data on heart attacks and cardiac arrest in the population. Then you look at these analyses done, for example, in Israel, But I think, again, coming back to, for me, the strongest bit of evidence was the original Pfizer's own trial data, revealing the report of serious adverse events were higher in the vaccine group than COVID admissions were, hospitalizations were in the placebo group. For me, that's the smoking gun. We've got a 6-month, high-quality, large randomized control trial that showed reduction in infection, which ultimately was only about 119 people needed to be vaccinated to prevent one being infected, although that was presented as relative risk as 95%. There was no reduction in COVID mortality in the trial, statistically significant. There was no reduction in all-cause mortality. And suddenly we've gone from that trial leading to the approval to coercion to mandates to suddenly being gospel truth that the COVID vaccine has saved millions of lives. I don't think the evidence is there to say that. These are speculation. These are, flawed studies. These are not high-quality studies to suggest that. And you're right. The actual randomized control trial data showed, if anything, as I mentioned in my paper, slightly more deaths in the vaccine group compared to the placebo. So when you put all of this together, it paints a very concerning, disturbing picture of what ultimately emerged in terms of the pandemic and misinformation on this. But as I say in the paper, the structures were already in place, Robert, to allow this situation to arise. This isn't an anomaly. This unchecked power of pharma. We had obviously the COVID situation, which was an emergency type of situation. We've never been in this before, this type of scenario. Therefore, decisions were taken, in a way that wouldn't have otherwise occurred if everything was generally pretty calm with drug development, etc. It was felt there was an emergency, and therefore decisions were making probably in a more rash way. But the exploitation of those decisions, maybe the fueling of those decisions, in my view, came from big pharma, who, Pfizer have made $37 billion in profit. For one of the most lucrative pharmacological interventions in the history of medicine, but probably one of the worst in terms of efficacy and the worst in terms of harms. So people need to think about that. If you join those dots together, you understand that this is a system failure that has allowed this to happen, and a system failure that is perpetuating the problem. Right now, Omicron that's circulating is very mild. It's no worse than the flu. It's a bad cold. This is a time to stop and pause and say, listen, we've got something with lots of doctors with serious concerns. The data is strong. And we need to pause this right now, investigate it, and figure out what happened. And then we need to reconstruct the system moving forward so it never happens again.
I'm very curious about what this has done to your life, because this was really, you're a very modest man, but this must have been very disruptive to your relationships and your power and credibility.
Yeah, so Robert, it's a great question. I'll come on to the power and credibility bit. Certainly in terms of relationships, you're right. I've fallen out with friends. In fact, I fell out with friends at the beginning when they were concerned about the vaccine, and I told them they were talking nonsense. So that was initial, but that we made up pretty quickly. That was fine. But actually, some of my relationships certainly have been strained with some of my closest friends and even family members at times. Even when I was in California last year, it took quite a lot of convincing and time for me to explain to my relatives that there was a serious issue with the vaccine. And one of the interesting things that came out of that conversation, even with doctors in the States as well, some of my friends, which I thought was very interesting, is the first response wasn't, okay, let's try and get to the truth and understand the science. They were, you can't say that because that means you're a Republican or you're on the far right or you're a Trump supporter. So they were politicizing science. And for me, that's intellectual bankruptcy. And it still is. We need to talk about the science and the evidence, not politicize it. So yeah, it did cause a strain. And for me also on a personal level, Robert, once I realized that the primary cause of my father's death, without any doubt in my mind, the most likely cause was the vaccine. He was the last surviving member of my immediate family. I lost my brother when I was young. I lost my mother a few years ago. For me, it was, and I live alone. And for me, it was particularly, it was a traumatic experience, but then I was carrying this with me, all this time. And I knew, even I spoke out a year ago on GB News when there was an initial link suggesting a link between the vaccine and the heart attacks. And a group of researchers at a very prestigious institution in this country, a whistleblower contacted me and said that they were covering up research that shows that the mRNA vaccine causes coronary inflammation and therefore linked to heart disease, and they compared vaccinated and unvaccinated, and they decided they weren't going to publish it because they said it may interfere with our research funding from pharma, which again is an example of the corporate, the pharmaceutical industry have captured even our institutions. Universities are supposed to be guardians of the truth and represent the moral conscience of society. But as we've said already, if they are being governed and influenced by a psychopathic entity, what's going to happen? This is the kind of toxic culture it creates. So with all of that, I spoke out on GB News. I didn't have a peer-reviewed paper myself, but behind the scenes, I got complaints from anonymous doctors contacting the people that hold my medical license, the Royal College of Physicians, and I was able to rebut it. But of course, it was stressful because I was sticking to the evidence. And I also said, listen, by the way, I'm not a so-called person that is trying to encourage vaccine hesitancy, because I promoted or I encouraged, I tackled it at the beginning. So that was also stressful. But for me, Robert, I've always, and this is what my father taught me, is always act with integrity, act in a truthful manner. It takes courage. We have to act virtuously. And of all the virtues, courage is the most important one. And that's ultimately my duty to patients. One of the other things, I've worked in health policy in different organizations over the years. One of them is called the King's Fund, which advises government on health policy. And I was a trustee of the King's Fund for 6 years. The maximum role you can have is for 6 years. And when I signed up to the King's Fund, one of the things that I was asked to sign or to read and sign was something called the 7 Nolan, was to basically declare that I would act according to the 7 Nolan principles. So these are principles set up in the UK that are supposed to be adhered to by anyone who has a duty to the public, who serves the public. So this includes doctors, the police, teachers, nurses, even politicians. And I always recite these 7 Nolan principles to people when I talk about how you should act as a doctor. And those principles are act through selflessness, objectivity, integrity, accountability, honesty, openness, and leadership. And leadership also means pointing out when people don't adhere to those principles. So for me, that is what drives me. That's my only primary motive, is to do the best I can for my patients, but it means acting with virtue. And I think a lot of people have forgotten that, Robert, unfortunately. I think if we go back to the basics, the Hippocratic Oath, and if our public figures and our policymakers acted virtuously, then I think the society would be in a much better position. The problem is the people that are influencing them and have too much control over our lives in many different ways, again, is an entity that is not human in the way that it approaches its business. And that's big pharma, that's big food, those are big corporations.
I really want to talk to you about sugar. Tell me something. I eat about a pint of ice cream a day. Is that something that you would recommend?
It's sugar-free ice cream. If it's keto ice cream, Robert, then there's no
reason. Just quickly, does that hurt your brain? Does the sugar hurt your brain?
Well, so the problem is over time, too much sugar, basically, it can create something called insulin resistance. And I'd love to talk about it another time, of course, but insulin resistance is really the root cause of many of the chronic diseases, from heart disease to dementia to cancer, etc. The good news, Robert, though, is very rapidly your risk factors and insulin resistance can be reversed, even within a few weeks of, say, quitting sugar.
Tell our listeners how they can find you on the internet and how they can support you.
That's really kind, Robert. So on Twitter, I'm Dr. Aseem Malhotra. Facebook, again, Dr. Aseem Malhotra. And I do have a Patreon if people want to contribute towards that, just because most of my work, I'm an activist, most of my work doesn't earn me money. But really, I want people just to see the message and read my articles, which are free and open access, and share them with people. That's what I want ultimately. For me, that's going to be the most important thing to change policy. And then I think the other thing that you were asking me about sugar, how does one quit sugar? Go cold turkey, basically. Eat real food. Don't have anything out of a packet. Don't have any sweets, any chocolates, any biscuits. But just do it for 3 to 6 weeks, because I'm not saying do this forever, but your palate changes, your cravings change, and often many of my patients, of course, rapidly actually improve their health markers and lose weight effortlessly just by quitting sugar. They don't go hungry. They eat till they're full. And I look forward to discussing this in more detail with you, hopefully, Robert, next time.
Thank you very much, Dr. Malhotra.